So you've had your hip scope done. You can move it. There's really okay. So you've had your hip scope done. What now? So it's important the next few days that you just take it easy. If you push too hard with any operation, it will get grumpy. So the first 72 hours is where things really are important to settle them down. So stay in bed, rest the leg, move it gently. It's okay to move it. We'll show you some exercises where you are allowed to move it. And typically you're allowed to start walking down through it as you feel comfortable. So at the start, we'll probably walk you with some crutches. And then you're on the crutches for about a week or so. But if you're feeling really comfortable on it before that time, it's okay to start to walk around short distances without them. When you're walking, we want you to walk as normally as possible. Now, a couple of things we want you to avoid with a hip scope is we don't want you to bend your hip past a right angle, okay? So we don't want it to come past that 90 degrees. So when you're sitting, you just got to be really careful not to lean too far forward. And when you're in the bed, don't bring your knee up too far. Now the other movements that we don't want you to do, we don't want you to do a lot of moving out to the side. And in particular, we don't want you to let your leg roll out like a butterfly wing, okay? What that does is it puts a lot of pressure on the area where they've gone into the hip joint to do the operation, okay? And so that can make you really sore in that area. So we want to protect that area at this point in time. In terms of physio, we'll give you some really simple exercises that's about getting gentle movement back into the leg, okay? And also learning how to contract your core muscles, which become a really important part of your rehabilitation moving forward. At the 2-week mark, when you go back and see your doctor, they'll check the wounds, they'll check how everything's going, and then at that point, you'll start further physio in terms of building the strength and the range back into your hip. It takes 6 weeks for the soft tissue. So if you've had the labrum repair, it takes 6 weeks for those tissues to heal. It takes 12 weeks for the bones to heal. So if they've done some trimming of the bones, then those areas are going to be a little bit raw for up to 12 weeks. So your rehab program is going to be reflective of what you've had done and how fast and how hard you can push into things. So your physio and your surgeon will guide you through that process at that point in time. Walking with the crutches, as I said, you can walk down through the crutches. You don't have to hop. And I want you to try and walk as normally as possible. Typically, most people are using the forearm crutches, and so it's just crutches forward first, step, and you're stepping through. Okay? To go up and down stairs, you'll go up with the good leg, okay, which will lift you up. Okay? You'll go down with the sore leg, which will lower you down. So it's good, we say good to heaven, bad to hell. And the crutches will always go with the operated leg. So going down a step, sore leg goes down with the crutches, going up a step, the good leg goes up, and then the crutches will come up with it. Okay? Good luck with your rehab. Our number's on the sheet. If you have any problems or you have any questions, give us a buzz. Take it nice and easy. Don't push it too hard. Have a happy hip when you go back for your appointment. Good luck with it.